So we have microneedling and we have RF or radio frequency microneedling, and that of course has energy involved. What are the differences? We'll also talk about derma rolling or stamping. Will any of them cause you to lose facial fat? And should you be doing RF microneedling at home? And if you are, what about facial fat loss with that? Will you even get to those levels without using anesthesia? So when you think of microneedling, the first thing to think of is you have needles that go into the skin. Regular microneedling uses needles that go into the skin, but there's no heating energy applied. Whereas when I'm referring to RF microneedling, I'm referring to using a device in which those needles have energy that produces heat. And that's in the form of RF or radio frequency energy. Now with both of these, why would we even want needles in the skin? How is that going to make you look younger? Well, the idea is when the needles go in, they cause somewhat damage. Everyone gets scared when they hear damage or when you hear scar tissue produced. Remember, damage short term and scar tissue or inflammation can be good or bad. When it's short term, that inflammation that the needles in the skin cause elicits a reaction from the body. And what is that? That's a repair response. You get lymphocytes, you get repair, white blood cells go there, platelets, because a lot of times as you guys do at home, you know, you get bleeding. So what do you want to do? You want to heal it. Platelets coagulate blood. But what do platelets have? Growth factors, mesenchymal stem cells, and you'll all know exosomes because many of you are using exosomes to microneedle into your face. We'll touch on that in a moment. So you're eliciting that response and you want repair. Here's what you don't want: prolonged inflammation from any of this, and you don't want ripping of the skin. Might sound obvious, but a lot of these devices, and people are using different stamps, the needles are placed in an array that are not straight perpendicular to the skin, and they can scratch and create bad scar tissue. So let's go through a couple. So if you're talking without energy, have I ever seen facial fat loss from microneedling without energy? And the simple answer is no. A caveat here: if you're doing this every day, if you're doing it too much, then you're creating inflammation. Inflammation in the skin, on the skin, will then allow, not to get too complex about it, but factors that will kill your skin and kill your facial fat to take over prolonged inflammation. That's what photo damage does, sun, and that's what causes fat loss and facial droop from sun, but you can get that from too much inflammation. So if used correctly, and that's my caveat. So let's go through the stamp, which is a simple stamp. It goes up and down. You can put in the vial solutions with vitamins, minerals, vitamin C, even retinols. People put Botox in there. So that's the stamp. Now you have the derma roller. These roll along and roll over the skin. Part of the complaint with these is that as they're rolling over, they produce a cone-shaped opening. And I do think these are not quite as effective as the pens that go up and down, but they are effective for delivery. So the roller, while isn't so effective for what we call collagen induction therapy or collagen production, they are good for delivery. And that's why if you're thinking of derma roller, my favorite is the Anti-Age Derma Roller System. I'll put a link below, and that uses growth factors to be delivered. It's just a 0.5, very superficial needle that goes into the skin with the derma rollers. The pens are mechanical, and it moves up and down at thousands of RPM, so you get multiple channels in the base. It has to be of good quality so the needles are straight up and down so you're not producing bad scar tissue. So that's microneedling. I like it. What results can you expect? Depends what you're infusing in. Now, if you're not infusing anything or something with minimal effect, that means the slip that you're placing on the skin, you can expect some reduction in fine lines, some superficial collagen to be produced. And again, this isn't something you want to do every day or even every week. Most people might do it once a month or two. You need healing. Exosomes and growth factors will allow it to heal quicker But in general, this is a once every month or two treatment. And you can expect those fine lines, a bit of glow. A lot of people might use vitamin C. Here's the caveat here. Yes, it does do those beneficial things. It will not lift a face. The problem with it is many of you are using slips or things that you're microneedling in that are not sterile, that are not approved for the body, that can cause a lot of harm. So be mindful what you're using, and that's why with the Anti-Age system, of course, and I think there are refills on my site, store.rajanimd.com. I'll check. Maybe I'll put below a link to it if we have those. But you can get refills, and there are other products on the market that many of you will comment that hopefully are sterile, but I want you to use something appropriate for your slip. Now, so I don't see fat loss from those types of devices as long as you're not creating inflammation. Let's go to energy. This is very important. RF microneedling, it's not a laser. It's the same needles that go in with the device, and there's many ways to do this, but the one I use has 49 little needles that go in about a square centimeter, and energy is delivered. Now, here is what you need to know. There are home devices. Let's talk there real quick. They have often variable energy. The needles often are not very sharp. Some of them produce scar tissue. They can create energy levels at one setting that are very different from the other settings. These devices have settings, and you can change mainly three things. Number one, your duration of pulse. So click, click. It goes into the skin and out. It can stay in the skin and fat layers longer or shorter, and that gives you different results. Number two, the level of heat. The more heat, the more burning, the more side effects, the more chances of hyperpigmentation, increased redness, or even permanent scarring. And then you can also change the depth of the needles, and this is key. Imagine if you go in 0.5 millimeters, very superficial, to when I'm going to get fat, I go 3.5 millimeters or even more. So that's going to get into the fat layer. So the depth is important. And that's why changing those parameters is key. And a lot of the at-home devices, talk sub $10,000 to $20,000 devices, are unpredictable. And unfortunately, I get a lot of DMs from people who've damaged their face with them. So just be careful. You definitely need to see an expert. Here's the other thing about the different devices that you need to know. The names you're going to hear at your practitioner's office are things like Morpheus, Fractora, Vivace, Endymed. I like a Lutronic Infinity. Lutronic also makes a Genius. There's 4 or 5 others. In the comments below, let me know which one you're getting at the clinic you go to, and I can also tell you what the heating mechanism, if that's a full heating needle or just a tip heating needle that they're using. And if you are going to a clinic to get it done, many people would do this because for me to get to the levels to get results, especially where I'm trying to get rid of fat, the lower face, the jowls, the submentum, I need to mess, as we say, lidocaine. I inject many cc's of lidocaine in the areas I'm trying to get rid of the fat because I'm using a high to medium heat, a long pulse duration, and I'm going deep. That's where the fat is. So for these reasons, I don't recommend at-home devices when you're adding energy. It's just too difficult, and who can really to mess themselves with lidocaine to get through the pain that you need to get the result. And again, you're going to elicit that response, the inflammation and the healing, the wound healing response, but you're also, of course, you're delivering heat, which helps contract the tissue, and of course, in my case, what I'm using for, to burn the fat away. And some of these devices heat only the tip of the needle, whereas others heat the whole shaft of the needle. Now, there's 2 schools of thought on this. For me, I want heat at only the tip. And the reason is I want a lot of heat for a long duration, deep, and as the device heats the whole needle, if you have one of those devices, you're going to have more effect to the outer dermis and epidermis of the skin. So you're going to have more effect on the visual surface of the skin, and that can lead to hyperpigmentation. It can lead to more scarring. It can lead, if you're using high levels, to a grid-like effect on the face, and that you hear of it being permanent. It's not that common. Most people, it's 2 weeks, and other people can last 6 to 8 to 12 weeks. It mostly goes away. Long-term pigmentation problems are very rare. But if you don't have the right device, if you don't have the right settings, you're going to run into problems. Who are you worried mostly about? Darker skin, my skin type and above. People with a history of melasma, people with a history of pigmentation problems, keloid scarring, where you get thick scars if you get cut. So those are all the things why you might go to a professional, because they're going to take a medical history. I do treat all those people. Of course, I'm going to take more risks than the average professional. I do thousands of these, and I can deal with the complications. The problem with the home gamers, often you can't deal with the complications. So I get the DMs on Instagram, on YouTube here, Facebook, and so on, and it's really hard to treat these people afterwards. Now, with facial fat loss and these devices, absolutely they can. As I say, every great device can cause damage. So like an airplane, a car, anything you have, a motorbike, they can all have great purposes if used well or nefarious purposes. So yes, but I want to get fat where I go deep, hot, long pulsation, and I want to get superficial skin where I go with specific settings for the superficial skin depending on the person. I'd say the other caution with the home gamers or just doing a few of these treatments, if you're treating hundreds, and in my case thousands of patients, I know the exact setting when you walk in the door and I take a medical history from you. If you're only treating one person or you're using settings that are kind of cookie cutter, you're not treating that person to the levels they need to be, and you're increasing the risk. So whenever you're listening to anyone on YouTube or getting your information, I always advise get it from someone in clinical practice treating hundreds of patients. It's better than any clinical study. I can tell you better than a study what's going to happen in the face with certain treatments because I do hundreds and thousands of these treatments. So keep that in mind. Absolutely, these devices get rid of facial fat. Luckily now, we do have a fix for these. And one of the best fix, if you lose facial fat, from dissolving fillers or from using these type of devices, or even things like HIFU or ultrasound, Ulthera type devices, platelet-rich fibrin, PRF, you can go to PlasmaFil, PlasmaFil.com, and you can see before and after pictures and how I do that procedure. But that's a great way to fix the facial fat, make it healthy again, the lymphatics, and it is all natural. So we have ways to fix these problems now that are all natural, but why get into the problem in the first place? These are not lasers. Lasers are totally separate. We can do another video on those, but I hope that gives you a great oversight on microneedling and microneedling with energy. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.